Welcome to Health Live at Seniors Today. As we mentioned last week, we are going to be having a two-part series on monsoon-related illnesses. And today is the second part of the same, and we are doing this in conjunction with the Fortis Hiranandani Hospital, which is in Vashi, Navi Mumbai. And we are delighted to have here with us Dr. Farah Ingale. Dr. Farah Ingale is Director Internal Medicine at the Fortis Hospital. Before I invite you to speak, I'm going to introduce her. Dr. Ingale is Director Internal Medicine, as I mentioned, at the Fortis Hiranandani Hospital. She boasts over 3 decades of experience in the hospital setting. She holds an MBBS, MD Medicine, DFID, Diabetes, PHFI, Diabetes, MCard, and the FICIC. Renowned as one of the most experienced doctors in her field, Dr. Ingale is dedicated to promoting health awareness and a healthy lifestyle. She has published numerous papers on topics including diabetes, renal disorders, immunomodulation, renal sepsis, kidney function, and metabolism. Additionally, she has been honored with a Silver Jubilee Memorial Prize for achieving first place in FMT. Welcome to Health Live at Seniors Today, Dr. Farah Ingale. How have you been?
Thank you so much, and thanks for the kind introduction. And good evening, everyone.
Thank you very much, Doctor. We are talking about monsoon-related illnesses. Of course, the monsoon has its ups and downs across the country. In Mumbai, where you are, it's of course when it rains, it pours. But we have a fair number of people from across the country. So in Delhi, for instance, there was almost a deluge 2 weeks back when it rained like crazy. Across the country, it has been raining. And, one of the things which was there is that people do complain about cold, cough, and assorted illnesses. And especially our audience of senior citizens are, feel that these are of huge concern. So we thought it would be good to have you. Last week, we looked at gut-related illnesses, and today we would request you to talk about cold cough, and assorted upper respiratory and other illnesses that people do come up with in this period. Over to you, Doctor.
Yeah, thank you so much. As you rightly said, with the scorching heat, and with this global warming setting in, environment has changed. It was so much of heat, hardly to bear, and people were waiting for monsoons to arrive. So to just get relief from this scorching heat. And we all know that water is essential for our life, but then it can bring in a host of problems, which I will take all of you through in a short while. Let me just open my slides. I'll share it with you.
Yeah. In the meantime, as Dr. Ingale's slideshow starts, those of you who have questions, please put them in the Q&A tab. And as always, please mention your age and your gender so she could give a considered reply. Yeah, the presentation is ready, so over to you.
Yeah. Is it visible? Can I begin?
Yes,
yeah.
Please.
Yeah, sure. So as I've just said, that water is an essential component of life, but it can be dangerous too, and it can bring in a host of problems to us. We will see that in 1 second, please. There's some adjustments to be made. So, just for your information, every person uses about 326 liters of water in a day. And in this season, that is monsoon, world's hospitals, half of them are filled by patients suffering from waterborne diseases, the incidence of which goes up to about 80% in monsoons. And 2.2 million die because of waterborne diseases every year, or you can say monsoon related illnesses every year, which is actually a number which is more than all the war deaths put together till now. So it can be really a serious problem. Monsoons makes us susceptible to many diseases, as the dampness and the stagnant water are perfect breeding grounds for many disease-causing microorganisms. So just to name a few, jaundice, typhoid, diarrhea are common this season, and also other ailments like viral fever, common colds, hepatitis, and leptospirosis, which is actually a monsoon illness, which can be life-threatening too. So why does these illnesses actually becomes so evident and so much does it affect the health of a person is because the sudden change in temperature and humidity causes the growth and survival of germs, and also the contaminated water, the stagnant water which becomes contaminated and which harbors all the germs, then that transmits infection to human beings by various means, which could be through food, through air, through water, through hands, flies. And also, we know that mosquitoes this season breed, and we get many mosquito related illnesses or diseases like malaria, dengue fever, chikungunya, and so on. So we see pools, water pools everywhere. Most of them are polluted, and then also rain-made collections, which weren't there before, but has happened in monsoons, which also harbors various organisms. So monsoon diseases are mainly waterborne and gastrointestinal, but this is also the time when mosquitoes breed, as I've said, which spreads the vector-borne ailments like I've already named. And also children and elderly people. We have this today for the senior citizens at all. So elderly people, especially because they have co-associated problems or comorbidities, because of which the immunity can be low in them, and especially they have comorbidities like diabetics, because of which, especially when the sugars are not under control, then they are prone to catch more infections. Then some of them are on immunosuppressive medications, like cancer patients especially, and these people are more vulnerable to catch infections faster. So, as I've said, water harbors viruses, bacteria, protozoa, and fungi. I think this was covered, as you have said, that last time you have covered waterborne, which could be bacillary dysentery, cholera, and typhoid. We know just a minute to each of it. Bacillary dysentery is caused by Shigella, and people present, the patients who get affected, person presents with loose motions, abdominal pain, cramps, and blood and mucus in stool, could become toxic and dehydrated. It's important to maintain the nutrition. To prevent that, you have to avoid outside food, maintain your hygiene, and have to drink potable water which is not contaminated. Cholera again is a waterborne disease caused by Vibrio cholerae, where patient presents with watery diarrhea, which is white in color. It is also called as rice water stool, which has fishy odor. The characteristic of cholera is cholera motions are it just is like opening a tap and the water gushes out without abdominal pain or cramps, and the copious amount of the water you lose can make you dehydrated fast. You may land up in peripheral circulatory failure. So it's important again to avoid outside food, to maintain hygiene, and if you get loose motions, to start drinking water, and plenty of fluids you should take, and especially oral rehydration solutions if you're able to. Otherwise, then we have to give you IV fluids and supportive medicines and antibiotics, the doctor which decide on. And just for your information, how do you know whether your hydration status is proper or not? Ideally, the color of your urine should be pale yellow. If it is little darker, that means you have milder dehydration. And you may not get symptoms when you have mild dehydration, but you need to increase on your water intake depending on the color of your urine. If it is still more dark, that means it is moderate dehydration, and too dark means it is severe dehydration. If it is moderate dehydration, then patient starts getting the symptom, or a person who is dehydrated start getting the symptoms of dryness of mouth, shortness of breath can happen, person may experience headache, and as I've already told you about the discoloration of urine, person may feel nauseous, may have vomitings, will not feel like eating. There may be loss of coordination, confusion in severe dehydration, and even the person may be febrile. The elevated core temperature causes the temperature to go up. So now again, typhoid is another one, which is also known as enteric fever, is caused by Salmonella Shigella, and it has got, the presentation is high continuous fever with headache, diarrhea, abdominal pain. This is again a waterborne illness by either drinking or by eating food which is contaminated. So here again, we need to give symptomatic treatment and antibiotics and supportive care. Vaccines are available. This is very important, especially our elderly population who already have comorbidities and whose immunity is less. To prevent them from getting infected, we encourage giving vaccines. We have vaccine for cholera available, which can give you protection for up to 3 to 6 months. The ideal time to take cholera vaccine is before the start of rains. It's an intramuscular injection. We also have vaccine for typhoid available, which gives you protection for up to 2 to 3 years. And every third year, we advise booster doses of typhoid vaccine. We even have the oral typhoid vaccine available and also the injectable one. Now, let us see the other diseases which are caused by parasites, which are also waterborne. This includes amoebiasis, worm infestations, leptospirosis, which I had already told you in the very beginning, a monsoon illness which can be dangerous, and malaria. Now, leptospirosis is actually, in rains, we have stagnant water. The ponds, the man-made ones, and also the lakes which gets contaminated. There is stagnant water on the roads. What happens is the rodents or the dogs, they excrete in that water. And the urine of these rodents or dogs, they that has this bacteria, the protozoa, sorry, that is called as leptospira, that contaminates the stagnant water. And if you waddle through that water, human beings I'm talking about, if they're barefooted, if they're not wearing protective shoes, like ideally those who waddle through the water or whose occupation is such that they have to work in the water, they should wear gum boots or something which will keep their feet dry, does not get wet. But if you're waddling through and if you have cuts and bruises on the skin, and especially diabetic patients who have callosities, who have ulcerations, a break in the skin, then these protozoa will enter the human body through these cuts and wounds and bruises and then goes into the circulation. This will present with malaise, fever, there can be rashes on the body, there will be redness of the eyes, person can get jaundice, it can also cause kidney failure and respiratory failure. Many of the patients require even dialysis and ventilatory support. Then we start them with antibiotics, of course, once they are tested positive. And as I've said, artificial ventilation, dialysis, some of them, if they bleed, may require blood and blood products. So prevention, best way is to prevent. And how do you prevent from getting infected from lepto? Is by wearing protective devices, especially for those who are occupationally exposed and other people as well, not to waddle in stagnant collected water. Rodent control is very important. Otherwise, the infected rodents will excrete this protozoa and that will infect humans. And you can even take chemoprophylaxis if you are in that field where you are exposed to the water. Then the doctor, you can consult a doctor and doctor will prescribe you doxycycline to prevent this leptospirosis infection from infecting you. Then floods are responsible for epidemic of leptospirosis. In fact, floods are responsible for 52% of total occurrence of calamities. It is more than cyclones, than landslides, earthquakes, everything put together. Then malaria, we know there are 4 types of malaria parasites, that is falciparum, vivax, ovale, and malari. In our country, we see falciparum and vivax. Falciparum causes 50% of all malarial infections and is the dangerous one, which could be lethal. Vivax also sometimes can cause serious infections. Then how is that transmitted? It is transmitted from one person to another by the bite of a female Anopheles mosquito that bites during dusk and dawn and needs a blood meal to feed her eggs. It's not transmitted by male mosquitoes. And person will present with fever, vomiting, diarrhea. If it is high fever, especially if it's a child, they may get febrile convulsions. Or if it is cerebral malaria, then also person or patient will get convulsions. The person would be pale because the RBCs gets ruptured. The parasites are in the RBCs, and that is how when the RBCs ruptures, The person looks pale, the hemoglobin falls, and then there can be jaundice. Patient may have cough, may have malaise, may have body aches, and spleen and liver is palpable on examination. And severe and complicated malaria is in the form of cerebral malaria, that is affection of the brain, where the patient will become unconscious, may have seizures, patient may go into coma. And anemia I've already told, because RBCs are affected, kidneys can get affected, and patients can land up in acute renal failure. The sugars can drop because patient has jaundice, will not feel like eating, patient has vomitings, and that is why the sugar levels can drop. And other complications like metabolic acidosis, circulatory collapse, and other complications can happen in malaria. And how do you diagnose? Is by doing a simple blood peripheral smear test. The thick blood film and the thin blood film is what we do to detect the level of parasitemia and to give more information on the parasites. And also, we have the antigen capture kits, that is called as RMAT, or Rapid Malaria Antigen Test. PCR test also, but it's expensive, that we normally not do. We normally do a peripheral smear and a antigen test. And treatment is with anti-malarials, which will give you complete cure if you report to the doctor at the earliest, if you're diagnosed at the earliest, and if you start with anti-malarials, you'll be completely cured. We also give treatment to prevent progression of uncomplicated malaria to severe disease and to prevent deaths and also to interrupt transmission. Because if there's an infected person and a mosquito bites that person, that mosquito will transmit the infection to another person. And then another disease which is caused by viruses. Now, diseases caused by viruses during monsoons, again waterborne, could be hepatitis A and E. Now we have hepatitis A, hepatitis B, C, and E. But B and C have parental transmission, while A and E are transmitted by fecal-oral route by either contaminated food or water. We have various diarrheas. Then we have dengue, which is again a viral illness, and viral flus. So hepatitis, I've already told you, is A and E, which is transmitted by either contaminated food or water, where the person suffering from hepatitis will present with fever, body ache, weakness, loss of hunger, nausea, vomiting. Urine will be dark yellow in color. There will be yellow discoloration of the eyes, skin, mucous membranes, and it can cause fulminant liver failure. So, but as such, because it is viral, there is no specific treatment. Mostly it is self restricted, supportive care, strict bed rest, good nursing care, adequate nutritional support, fat restriction, and liberal use of sugars and carbohydrates, because they usually go into hypoglycemia otherwise. And if the person is dehydrated, we start with the IV fluids. And there are vaccines available for hepatitis A. And those vaccines, we give 2 doses in young people, but more than 9 years, we give a single dose. Then we have dengue fever, which is also known as breakbone fever. It's an acute communicable disease which is caused by virus transmitted by Aedes aegypti mosquitoes. And dengue viruses actually are of 4 types: Den 1, Den 2, Den 3, and Den 4. And then these dengue viruses, which transmit the dengue fever in the dengue infection to humans, actually, as I've said, are of 4 types. So in your lifetime, you may get dengue up to 4 times. This the situation worldwide regarding dengue is about 50 million cases are seen annually worldwide. Incidence is highest in the tropical and the subtropical regions, and recent increase in disease activity has been noted worldwide. And each serotype provides specific lifetime immunity and also short term cross immunity. But they can be severe infections, fatal infections because of dengue. And it is also caused by infected female mosquito. It is primarily a daytime feeder. And the peak biting is at dawn and dusk. These dengue mosquitoes, they breed on a clean water inside your house mostly. They live around the human habitation. They lay eggs and produce larvae, preferably in artificial containers. So what happens is when there's an infected person, the Aedes, this mosquito which transmits the dengue virus, they bite the infected person, and from them they bite to when they bite to a healthy person, the disease gets transmitted. The incubation period is the period from the time when the virus enters your body to the time you get the symptoms. That is normally between 3 to 14 days, but mostly you can symptoms between 4 to 7 days. Dengue fever is not spread by contact with infected persons. Many a time patients ask us that one person is suffering from dengue. Would that patient transmit infection to another patient? It is not through person to person. The vector is the mosquito. And what are the clinical features? The person will present with fever, headache, muscle and joint pains, may have nausea, vomiting, rashes on the body. There can be hemorrhagic manifestations because the platelet counts reduces in dengue. The lesser the platelet count, more are the chances of bleeding. There may be itching, there may be metallic taste, and so on. So at present, because it is virus, there is no specific drug that can treat dengue fever effectively. But patients should preferably kept in a mosquito-free environment to prevent the spread of the disease. And for we have to give symptomatic treatment to the patients, like for high fever you do the sponging with lukewarm water or tepid sponging, which we call it as, or with normal water. You can give them drugs to just anti febrile drugs like paracetamol can be given, but aspirin and all we avoid giving to these patients. And this is just for your information as to where the dengue mosquitoes can breed. So it is in the flower pots in your house if there is water stagnant in the flower pot. That is, and even the trays kept below the plots. If it is not kept dried, the mosquitoes of dengue can breed. Then hardened soil of potted plants many a time has water layer which is stagnant on it, can breed these mosquitoes. The collar of the toilet bowl where there is water accumulated, the gully traps, then roadside drains around your house, and then scupper drain, and also the roof gutters and the tree holes in the garden where there's water accumulated, the plant axils also where the water is accumulated, and an air conditioned tray if it is not kept dry, if there's water collected, and the canvas sheets which you put on your bikes and all where there is stagnant water on it can breed the dengue mosquitoes. So, to prevent the spread of dengue fever, we must first prevent the breeding of the vector, that is the Aedes mosquito. These Aedes mosquitoes actually are easily identifiable because they have a distinctive black and white strips on their body, and it prefers to breed in clean, stagnant water found in our houses, near our homes. And so, ideally, we should turn the pails and watering cans over and store them under shelter. There should be no water collected. You have to turn them upside down. And then, anti mosquito walls are available, which can be fitted to prevent mosquitoes from coming in through those drains. And we can install mosquito nets to doors and windows so that mosquitoes can't get in. The best protection is to avoid being bitten by mosquitoes. So, what you should do for that is avoid staying in the dark, outdoor places like brushwood, pavilions, or the shades of the trees during the hours when this mosquito is active. Avoid applying high deep concentration products, but you can use mosquito repellents, of course. But if it is more than 35%, it may be harmful to your skin. And accommodation should have air conditioners or mosquito nets. You can hang mosquito screens around your bed. You can even use mosquito coil if there's no issues of you using mosquito coil. Coming to airborne infections, because which are normally seen in monsoon, one is influenza. Now, this influenza is commonly known as common flu. which is transmitted in the same manner as tuberculosis. That means there is droplet infection. When the infected person coughs or sneezes, the person then just coughs out the viruses, and that can get transmitted to a person who is in the vicinity. And because the virus can be stopped by soap, frequent hand washing can reduce the risk of infection. So when you sneeze, actually, you should use some handkerchief or other cloth or napkin or something. Otherwise, if you sneeze on your fingers or hand, and if you touch your hand somewhere, then you can transmit that infection. Or otherwise, you can wash your hands immediately to prevent transmission. So airborne disease symptoms are: one is there can be runny nose, patient may cough, may have fever, there may be muscles or body aches, sore throat, may feel fatigued, lethargic, and headaches can be there. So, how can you prevent the flu? You have to avoid close contact with the infected person. Maintain a distance of at least 6 feet. Now, this 6 feet distance, I'm sure you all must be remembering that, because that was so many times hammered on you during COVID times. Then it is better to stay home when you are sick. Complete rest, because when you are not well, your body needs complete rest to recuperate faster. And as I've said, cover your mouth and nose while sneezing or coughing. Clean your hands. Avoid touching your eyes, nose, or mouth. And practice other good health habits. And we have the vaccine for influenza. We have Flucodri or Influvac vaccine, which gives you protection against 4 viruses. And if you are less than 8 years old, then you require 1 or 2 doses of vaccine. But more than 9 years, there's only one vaccine required every year. You have to take this influenza vaccine every year. So, how to deal with cough, cold, and fever? Need to wash your hands before every meal properly with soap and water. You may carry hand sanitizer, which can save you from picking the germ related illnesses like cold and cough. It's always better to avoid eating outside and stick to freshly prepared homemade food. Drink only clean boiled water or use water purifiers if they are maintained. Wear clothing that can protect you from mosquito bites. Then you should take a warm water bath as soon as you get home, which is the best way to increase your body's immunity. Protect yourself from mosquitoes by using nets and repellents at home. Discourage children from playing in dirty water or in the water which is stagnated. And I've already told you that cover your mouth with a handkerchief while coughing or sneezing. Eat plenty of fresh fruits and green leafy vegetables after washing them properly. Actually, you should soak the fruits and vegetables for at least 5 minutes in the water and then rub and wash them with 3 4 washes. Then you should swim only in the pools that are cleaned properly, as these carry a good source of infection if it's not cleaned properly. Ensure that your neighborhood is kept as clean as possible. Prevent mosquito breeding by removing junk, covering open overhead tanks. And for the administration, the slide is that they should maintain proper sanitization and sewage disposable techniques have to be employed. We should ensure clean and safe water supply. Hygienic food preparation and quality testing at the restaurant should be done. And also safe drinking water at home should be supplied. So prevention is always better than cure. Use the water purifiers which are maintained, otherwise boil the water properly, keep it covered, and also wash your hands thoroughly with soap and water in case if you want to prevent from getting infected. So don't let the monsoon bring a rain of illnesses to you. Take proper precautions to stay safe during the monsoons. That's all from my side. Thank you so much.
Thank you very much, Dr. Ingale, for a very detailed presentation. Yeah, so amazing presentation. Thank you very much. What
Thank
are
you so
a few
much.
questions that have come in by by WhatsApp, and those of you who have questions, please send them to us. Uh, the first question which is there is about the influenza vaccine that you have
Yes.
mentioned.
Yeah.
Now, uh, Doctor, we know we've been mentioned that it should be taken once a year, but
Yes.
when is the ideal time to take a vaccine, and when does the update happen every year? So, if one has missed out before the monsoon, should one take it before the monsoon, or should one take it in the winter?
It has to be ideally taken before the onset of winters because maximum number of cases seen are during winter time. And once you take the vaccine, it takes at least a week or two to give its effect. And why it has to be taken every year is because the viruses undergoes mutations. So the last batch which was there the last year may not be effective this year because the viruses undergoes mutations. The structure of the virus changes. That is why every year they come up with an updated vaccine to prevent from the infections which can happen that year. So every year one dose, and that the best time to take is before the onset of winter, and a new batch every time.
Now, this person has asked another question. Says, Doctor, we've heard about the vaccine on the health webinar in the past, but I'm always worried about the after effects of the vaccination. And also, I do some travel. So after the vaccine is taken, what are the restrictions that are there on the person uh, for the 1 or 2 weeks that are required?
Then you take all the preventive measures because after taking any vaccine, immediately you may not get the effect of the vaccine. Usually, you don't get the effect of the vaccine within a day or two. So you have to take all the precautions. Like if you're going out in an overcrowded environment where there will be a lot of people around you, if there's no fresh air, then you better use a mask. But the mask also has to be used properly. You can, if you are more prone for infections, if your immunity is low, if you have comorbidities, if you're elderly, you better use a N95 mask. But the mask has to be properly worn. It has to cover from the bridge of the nose to below the jaw and on the sides. If it's not properly worn, if it's open from the sides, then you can catch infections anyways. And it's as good as not using a mask. Otherwise, if you use the mask properly, it will give you 90%, 95% protection. Secondly, eat good, nutritious food, healthy food, and balanced diet. Concentrate more on protein because proteins are the building blocks and they help to improve on your immunity. Properly follow all hygienic practices. Wash your hands with soap and water. You may use a hand sanitizer. Drink only boiled and cool water or filtered water if filter is maintained. Avoid outside food. Have good sleep. That's also very important. It's a part of your healthy life that you should have proper, peaceful, uninterrupted sleep of at least 6 to 7 hours. So that helps the body to recuperate. And nutritious food, all this is important. And if possible, avoid going out in such places where you have crowds when the infection is already around. If it is unavoidable, then you take precautions and then move out.
Doctor, we have another question which is coming from an anonymous attendee. Says, Doctor, there are so many people who are down with dengue, malaria, and various other viral forms, and one can't really always uh, uh, stay away from it because you may be going out to the society to take a walk, or you may be going to the market to a shop. So how does one prevent oneself from getting the virus uh, and getting infected?
So, if you talk about malaria and dengue, both are vector-borne diseases which are transmitted to person by a bite of an infected mosquito. If you're going out, one is your clothing which you wear. Use a full sleeve cloth. You can use trousers which are thick so that even if the mosquito sits on your trouser, it is not able to sting you. You can wear shoes with thick cotton socks. You can apply mosquito repellents, odomos or something can be applied. At least that will give you protection for some time. When you go out and come back, that should be able to protect you for that time. And then when you, like if you're going out, and of course the general measures which I had already told you, that will help you to stay active, and immunity will be good if you eat balanced diet, take rest, exercise, have proper sleep, in that case, even if a mosquito bite you, your body may be able to take care of yourself, and you may not fall that ill, and you may not be that serious if your immunity is good. But otherwise, as I've said, you use a proper clothing to go out, and you use mosquito repellents like Odomos or something you can apply on your exposed skin. Full
Right.
sleeve shirts, trousers, socks, and all that you have to use. Wear, basically.
Right. Thank you. Doctor, we have one more question about mosquito repellents now.
Yeah.
Doctor, how safe are the mosquito repellents? Uh, one is, of course, the ones which you apply on the skin. Then there are these, coils that are there. And now you
Yes.
have the likes of Good Night, etc.,
Correct.
which are where you put a tablet or there's some liquid over there. Is it
Hmm.
safe? And how much time can one? I normally put it on all night. Uh, is that safe or is it unsafe?
See, for those who don't have any allergic issues, it is safe for them. Okay. And I've told you the maximum biting time is, the maximum time is between dawn and dusk, at dawn and dusk. That is the time when the mosquitoes can enter your houses. You use mosquito nets in your house. You can close the doors and windows by about evening. And then usually once, if you do all that, the mosquitoes may not enter your house. Of course, your fans will be on, your AC will be on. That will also help you. But otherwise, mosquito nets you use in case if you're allergic to all these chemicals. Otherwise, usually those who tolerate it well, should not be a problem. Only those who are asthmatic, those who have allergic issues may have difficulty in breathing when they are exposed to the fumes. And if they apply the ointments like the Odomos or something which is available, if you have allergic problems, then you may get rashes, itching, or something because of the application. Otherwise, usually people tolerate that well. Then you have to take precautions. You have to adopt something else. Use the mosquito nets, and you can use the nets on the windows and doors.
Doctor, we have one more question. Doctor, in your presentation, you mentioned about dengue and the incidence of dengue happens. One contracts the dengue virus when it in the early in the mornings. So does this mean that we need to be extra cautious in the morning and perhaps even avoid taking a morning walk in the mornings?
No, that's what I told you, that the mosquitoes which transmit dengue actually breed on the water which is clean and in your house and around your house. So
Right.
don't let the water get stagnant or accumulated inside your house. The places I have shown you in the pictures where
Right.
there's a possibility of mosquitoes breeding. So that you have to see first. Keep the areas dry around only in your washroom, in your bathroom, or wherever, the flower pots and all that has to be kept dry. And then secondly, again, you can use the mosquito repellents. You can use the ointments, the creams, and you can go for a walk. There's no problem. Use the clothing properly, wear shoes properly so that they don't bite you. You can still go for morning walks. There is maximum intensity and that there's a peak time for them to bite, but then you can take precautions and move out. No issues.
Right. Uh, Doctor, we have a question from Mr. Basavraj Nakashati, who says he is 67. He wants to know whether it's all right to use ointments like Odomos on the face.
Yeah, people use it on the face. Many of them use it on the face. If you're not allergic to, then it is all right. You can use it.
Face. All right. Uh, Doctor, I think most of the questions that I have asked are repetitive, so I'm going to stop at this. Thank you very much, Doctor, for
Thank
an
you.
amazing session and very informative. And to all of you here, we've done the two-part series on monsoon-related illnesses. As always, these will be there on the website. So if there are some parts of the presentation that you may have missed out on or you may not have paid attention to, the edited video, which will of course have the entire presentation, will be there on the Seniors Today website on Monday evening, along with takeaways which are written by a qualified medical practitioner. So these will be there on the website. You can go through it again and arm yourself with all the information that is required. Thank you very much, Dr. Farah Ingale, for being
So
here,
much.
and thank you to the team at Fortis Hiranandani Hospital in Navi Mumbai for facilitating this. Thank you very much.
Thank you so much. Yeah.
subscribe now and press the bell icon. Never miss an update.